negative result. And as of today, we have a testing capacity of 5,000 tests per day. We don't have a 5,000 demand per day, but we are ready as of today, if necessary, in the following days, and it will even increase. So as of today, we have a capacity in terms of both taking the tests and analyzing them of 5,000. So that goes beyond the demand, and we have managed to catch up to the number of people wanting tests. So, of course, it's important to say that the more we test, the more the numbers increase. So we have to be careful when we analyze the growth of cases. We could expect it with the number of tests, that we are around 120. I also wish to reassure all Quebecers there are all sorts of things being said on the equipment. Right now, we have all the equipment that we needed in the short term, whether it be swabs for the test, whether it be masks, whether it be gloves, whether it be respirators, or anything else. And we continue adding to that equipment in case the growth is going to be much stronger. But in the short term, we have all the equipment, including visors. What people of public health are also confirming to me is that the measures that we have taken are giving results. So let's be prudent when we analyze things. It takes a certain amount of time before we can see the results. And also there's more testing, so it's normal that there are more positive results. Today, I wish to add a general guideline to the ones that have already been announced. I would ask Quebecers, when it is not essential, to not travel from one region to the next. So that's important. We are following the situation region per region. For the time being, we don't need to shut down any region, but it is important in order to avoid spreading the virus from one region to the next to not travel unless it be essential from one region to the next. I also wish to talk about certain of the guidelines that are not being followed right now by everyone. Let's start now with people 70 years and over. This is not the time to go to shopping malls. This is not the time to go spend an hour at the restaurant with your friends. I feel like going back and singing Jean-Pierre Ferland's song, Envoyez à maison. Go back home. That's where you have to be. It doesn't mean that you can't go out and have some fresh air. Of course, on the contrary, go. It's good for physical health. It's good for mental health. But don't do so by getting together with other people in a shopping mall and restaurants or in any other place. A message perhaps to the young and perhaps not so young. Call your parents, call your grandparents. There are phones. That's good for them as well to hear from you. And I also wish to get back to what I said, perhaps more clearly to young people, but it's applicable to everyone. It's not a good idea to have dinners, 7 or 8 people getting together. That's not a good idea. So no gatherings, even in homes. Now, the people who have symptoms, it's important to specify it. Symptoms such as fever, coughing, a hard time breathing. First of all, stay home and make sure that you are not in contact with anybody. And then call 1-877-644-4545 and you'll be taken care of. It's going very well on that end. Now, a message, and Danielle was saying so yesterday, but I will repeat it. Anybody who has problems other than those that may be associated to the coronavirus, as much as possible, do not go to hospitals. Call your family doctor. And those who do not have a family doctor, call a clinic in your neighborhood. You'll see the situation. We have a good agreement with family doctors. All consultations done over the phone are paid. And everything that can be done over the phone rather than in person should be done over the phone. And we have very good collaboration with all family doctors. And of course, it's a lot quicker. So everything that you can do over the phone, call your family doctor. If you don't have one, call 1 or 2 clinics in your neighborhood, and you should be able to find a doctor who be able to respond to your needs. Now, to end with, my daily thanks, if I could call it that, I wish to particularly thank all those who feed us. It's important. I'm talking about people who work in the agricultural domain and processors and the truckers, anybody who works in grocery stores. I understand that there can be people who may be worried. We repeat the guidelines of Dr. Arruda. Always remain 1 or 2 meters away from other people. Wash your hands during 20 seconds regularly. And we don't know how long the crisis is going to last, but in any scenario, we need you. We need the people who feed us. So you have a primordial role to play in the next few weeks. And I wish to thank you, all of those who are working in the food chain. We truly need you. So I would like to end by saying, in repeating, that every gesture that allows limiting contacts with other people is going to allow us to limit the contagion and is going to allow us to save lives. So I wish to thank all Quebecers. I thank you for your collaboration, and together we are going to get through this. Question. We've understood that 5,000 tests is 5,000 tests with results. Is that correct? Yes. Why limit displacement between regions? Do you believe right now that you may have transmissions other than what Dr. Arruda has been fearing for the past few days? Well, I'm going to let Dr. Arruda complete, but if you look at things regionally, the number of cases, for example, in percentage, there are regions where there's more and regions where there's less. So we want to make sure, of course, that the ones that have fewer remain with fewer cases, that there's no transmissions between the regions. Yes, and I'd also like to come back to another element, another message that I wish to tell the public. Right now, there are probably people who may be infected, but we don't yet have a situation, I would tell you, where we have intense circulation, where we'd say, you know, we have to close the city. Because what is happening, it's all very dynamic. But as you know, China managed through very strict measures to less contaminate the other provinces, but there were international flights. Let's imagine a region that really has transmission that is active, and elsewhere it is not. Well, we don't necessarily want for non-essential things. We don't want people to go from one place to another. So right now we're still ahead of things in order to prepare ourselves. But we're not there yet right now. If we get there, you will be informed, and people have to understand why we do these things. And it's not complicated. It's not transmitted necessarily. You know, it's human beings who are either infected with symptoms or perhaps sometimes without symptoms who go elsewhere and they transmit the virus. I mean, the virus doesn't fall off the sky through snow or rain. It's when people move around. For example, the epidemiological profile were mainly Chinese people, so it's countries that have exchanges with us, with them. So it's the transportation corridors where one person is affected. Well, we try to go there and to decrease the spread, to not entirely eliminate it, because that's almost impossible, but reduce it, spread it out over time. And that means something else right now. Right now, now that the week is off, there are cases in Quebec that are going to have been acquired by people who will have traveled, who won't have many symptoms, and they'll transmit it to others. When the Premier tells you that we have to do certain things, it's not the time to stop. What I wish to tell you, it's really important. Everything that we've announced up until now, our success of intervention depends on not what I've prescribed, but on how the patient is going to do what we tell them to do. If there's 50% of people who are not following the guidelines, we have much less potential. That is why it's so important to do it, that we identify also the places where it's not done, and we repeat and repeat and repeat the guidelines. People have to understand. Now, a dinner party with 9 people, we can't guarantee that those people are not incubating. People don't want to infect anybody, but it's not the time. Just postpone that till later. That's what's important that you understand as well. And at the same time, it is perhaps going to take a long time, and we also don't want people to go into panic because they feel that they're completely recluded. There's the phone. There's the web. Take advantage to do things that you love to do and that you never have the time to do on your own. Now you're going to have peace and quiet to be able to do that. The same family can remain together, but it's not necessarily to go and party at grandma's who's turning 100. No. So, people who get together every Saturday night for a dinner party, it's not time to do that. Try to find things that are going to make you feel good in the situation, but that don't require gathering. I'm not saying that you can't, see the light of day and go outside. No, we're going to have we're going to develop people with psychosis if we do that. But think about, do I need that? Okay, I need to go out and I'm stressed out. I might listen to music. Don't panic. Do what makes you happy. Everybody's different. I like going to the theater, so I can't go to the theater, but I listen to music to make myself happier. Everybody can find something. Try to do what you normally can't do because you're too busy. What you wanted to do when you're retired and you keep thinking you're going to do it when you retire, do it now. It's time. As long as you don't get together with other people. You want to go into social networking. You want to help people out through the web. You want to help out friends. Go. You want to go out for a walk. Even somebody who's 70 or 75. Well, go but don't be 5 people walking around. Do you understand? Don't get together with other people. That distancing is important. If you're alone and you go and have a nice walk in the forest, you're going to calm down. You're going to breathe fresh air, and it's beautiful. You have to be able to do those things. You have to understand the reason why we ask you to do certain things. Don't get stuck at home without doing anything. You'll just get depressed. Me, over the weekend, just to give you an example, I need to cook. So I like cooking Portuguese cookies. I'm trying to find new recipes, and it makes me happy because now I have the time to do that, those little pastries. Anyway, that's my plan. I know that I'm talking a lot, but I want you to understand why we're doing things. Please, I beseech you, do what we tell you. Take advantage of it. Do it positively. Transform this into something positive. And I'm sorry, I'm over. I'm done. I think it's clear. The number of cases that we're talking about today, these were tests that were made when exactly in time. So is this a portrait of like 3 days ago, 2 days ago? How long does it take after having had a test to get the result to know whether it's positive or negative? Well, things are going to be changing now because we now have 8 labs. At the time, 2 or 3 days ago, we only had 1 lab. So it took longer to get the results back then, but now we have a much higher capacity with those 8 labs. Therefore, things are going to accelerate, and so it's going to be quicker. But my question was, what is a delay? Right now, I think it's around 2 days, but I was just telling you it evolves from 1 hour to the next because we are still setting up the labs. We're going to have a great capacity, 5,000. So it's going to change from 1 hour to the next. I would like to know, the education decree, does that mean that we're going to force teachers to go back to the workforce? And should we think that there might be another decree in the health sector? Well, we've already had one in the health sector that gave a lot of power to the health minister. First of all, I want to come back to what happened in the education domain. First of all, we should have communicated with the union, with the CSQ. We did so, And I think that this is managed. These are preventive measures. Right now, we're not using any of those powers, but it's just important to give ourselves that possibility. You know that in schools right now, there are educators who are working, taking care of children. So we have to be able to have a certain flexibility because not within the usual schedules. And that is why we adopted this. And we're going to, make you aware. And we're going to keep the union representatives aware. But right now, nothing is planned. There are thousands of elderly Quebecers coming back from Florida right now who arrive at the border, they arrive at the airports. Are there measures planned for those people to create awareness in them, to make them aware of what's going on, to make sure that they respect the guidelines? Do they have special guidelines? Well, I would tell, first of all, there are guidelines now at the airport, so those who arrive at the airport, who cross the border, will know. And that is part of the work that we do today. I address myself to them, those who have arrived and perhaps have not heard the guidelines. Well, we have to continue giving them, and we're going to be doing so in the next few days. And the ads that we've started in the different media, so that's important. And I'm counting on all Quebecers, those who already know the guidelines and who know people arriving from Florida who are perhaps not aware, inform them of what those guidelines are. I beseech the families of those families to really warn them. And if we look at the trajectory that they're going to take when they come back from Florida to go up, there are very, zones that are very affected. If they stop in a place and don't wash their hands, and without even knowing it, perhaps they didn't get contaminated in Florida, but perhaps they got contaminated while crossing in New York, and they show, ill 10 days later. So this is not the time to go and see other people to show the pictures. So the same message as all the others is put yourself in voluntary isolation for 14 days. If you are ill, you quickly consult, and it is not time to have social activities with other people to, celebrate your return to Quebec. And also the border agents, we have the commitment of the federal government that they are going to be giving that information, and that here it is isolation for 14 days. So all customs officers know this. The economy of Quebec right now has pretty much stopped. There's nothing working normally. How long do you believe, economically speaking, can Quebec support a situation such as this one, whether it be for businesses or the government with all the budget measures that you are setting up? Well, listen, I would invite you to perhaps be a little bit patient. At 4 p.m., we're going to concentrate on the economy. We're going to be announcing measures for businesses, and we're going to be explaining a little bit how we see things unfolding. For businesses, large businesses, small ones, how we're going to be working with them to help them. But how long? Well, if you know, I would like for you to tell me. What we know, it's going to last weeks, perhaps months. Of course, all the measures that we are taking when we tell people to not go out, well, people are not going to consume. So there is an impact already there on the economy. So on top of the international commercial exchanges that have decreased quite a bit in the last few weeks, we have impacts following the measures. But in the balance of inconveniences, we were very conscious that imposing certain measures, for example, asking people not to go out, that it has a negative impact on consumption. For example, on businesses. We've been talking a lot about the elderly that are more at risk. But we also notice that in the United States and in Ontario, there are many people in their 40s as well who are being very affected. Even here in the hospitalization cases, there apparently are people in their 40s without any previous health problems. Do we see any complications with these young people? Listen, we've told you, anybody can get ill. In young children, we don't have many hospitalizations, but there's always exceptions. We're just going with statistics here. When we talk about people who are going to be hospitalized, there's one category of people in terms of quantities. And if you're older, there's more probability of getting complications, more probability of dying. And there might be a young person who, for all sorts of reasons, might also die. but it remains the same epidemiology. It is normal that we find people who are in good shape, who might be hospitalized, but that is not the most common portrait. And that's why we've insisted, the reason we insisted on the elderly is that we know that they're going to end up in intensive care. And the older they are, the higher the risk that they will be ill and that they're going to die and not be able to be extubated from the respirator. And that is why we're trying to say, even if you're not at risk, it's better not to catch it. I don't know if you understand. Even if you're 45 and you run, you're in really good shape, if you can avoid catching it, so much the better, because who says that that's not the person who's going to have complications? The message we've given is where the risk is higher. But at some point, everybody's going to be at risk. There are children who are going to have kind of like a cold, who might not even, we won't even realize that they're ill, but they might infect somebody else. So eventually what's going to help us the most isn't so much in the communities in China that the virus got transmitted. It was in family gatherings at home. And we're going to have presentations eventually on just the technical aspect with journalists so that you understand the analysis of what the experts are coming up with of what happened. Anyway. And I just want to add, it's important when we look at the numbers. Today we're saying 121 people who are infected, 7 hospitalizations. The key is a lot, the 7 hospitalizations. It's probably all elderly people. So having the virus is one thing. Having serious consequences that can lead up to death. For sure, the percentages and probabilities is that there's going to be a lot of people who are going to be older in those groups who are hospitalized. That is why we're following both numbers a lot. What reassures me today is that there's only 7 people who have been hospitalized up until now. So you took early measures. And we've seen in France that they have started handing out permits to circulate. Is that a good idea? Well, we have to look at it in, where France is. We're not there at that stage. We don't want to get to the stage that France is at, and certainly not Italy. What I'm telling you is that any measure, it's the sum of measures that is important. That's what I'm telling you. If people, get lax, and we start giving permits and we catch somebody, I don't know, that we stop, not catch, but anyway, that we stop 20%. Well, it's already going to be too late. I don't know if you understand. That's why we're calling out to civil society. You may have an approach, we could have an approach where we send police officers to you, or even the army, if we want to empty the streets, but we're not there. But I can tell you, if ever I think that we need the army because there's social disorder or anything, well, we'll have discussions about it, but we're not there. Because up until now, I want to congratulate Quebecers because I think they've understood very well. Even there are businesses that have decided to go further. Of course, the economy is slowing down and all that, but it is crucial. It's a crucial approach. And we, the people from public health, we're going to continue investigating cases and contacts so that the contacts and those stories, those people don't start going all over the place. And at some point, we'll see how it goes. And if we need stronger measures, we will take them. But the more people collaborate with us, the better success we'll have and the less we'll need those measures that, of course, are preventing people from being as free as they're used to being, But if it's needed, we have the powers to go into war measures. You explained to us what community contamination was. You talked about first, second, and third generation, and we felt that it was perhaps moving on that front. Do we have any idea right now, out of the 121 people who have been infected, what the proportion is of people who caught it elsewhere, people, whether it's first or second, third generation contamination, or is there anybody that we don't know where they were contaminated? Yes, everything that you say is true, but the very vast majority was still in a model of import. I'm not the one who's saying it. I have no fear of telling you what the scientists have been telling us, so I'm telling you we're probably going to now we're going to have to explain that. We are still a country, we're still a province, if you'll allow me, A nation, okay, fine. Nation, I think it's been recognized as such. Okay, so we're still a nation where most cases have been introduced through travel. That doesn't mean that somebody didn't come back and didn't contaminate their mother or brother, but we're still in a transmission which mainly is associated to traveling. In closing the borders, of course, with time, the cases that will appear, the link between traveling and the cases is going to lessen. That is where we'll have community transmission. Right now, to my knowledge, we are at one generation about. We're not at second, we're not at three. And we might be at third generation in a city or a sector, but not in another. We might be at three generations in the metropolitan area, for example, but only in Quebec. And what we want to do now, and that is why we're asking you to collaborate to not get to third generation, and we have investigations in each case so that those who are already at second generation don't get to the third. This is a race. After cases and contacts, it's a race against time, but everybody has to do their utmost. I would like to add on that, even the health network, that's what we've been doing right now. The Premier said so. Services are going to be given as much as possible over the phone, but also by teleconsultation. So in clinics, specialized doctors, hospital services, web consultation as much as possible. But in many, many cases, it is possible. So we've organized all of that. It's being deployed as we speak. And even in mental health, as I was saying yesterday. So we don't want people to move around if they don't have to. So that effort of social distancing, we also are doing it in the network. And the communities are getting organized. What we've been hearing in every single region of Quebec is that the mayors, the civil security are getting organized. We really want to take care of our communities. So I think that there's a movement, a mobilization, and everybody is following for social distancing, and that will make us get closer to one another. So, yeah, I will go now to English questions.
Good afternoon. Good afternoon. There are quite a few people that are complying, respecting the rules and staying home, but there are other people, as you have said, Mr. Premier, a number of times, you want people to keep working. But these people are finding that in the workplace, there are people who are not respecting the social distance, and they are being exposed possibly. And as we know, this was also a case on the among construction workers. There was some talk of that. Mm-hmm. Are you considering possibly shutting down non-essential businesses? Or the New York governor just announced that in some of their businesses, they're telling 75% of the people to stay home, and they're operating with a smaller pool of employees. Are any of these options being examined?
Okay. Nothing is excluded, but if you take, for example, the construction sector, we had many talks yesterday with their representatives. We have to make a difference between the work and, for example, if they go and eat together in a small place, if they need to have a place to wash their hands. They have to make sure to have all those things that we suggested since the beginning. So far, I think we were able to satisfy everybody. And we have to understand that the economy has to keep going. We still have services, goods that will be needed in the next weeks, in the next months. So the economy and also people have to get some money. Of course, the total amount we can inject in the economy is not unlimited. So we have to respect what Dr. Arruda is saying, but we can do that in most of the companies.
Question sent by email from Raquel Fletcher. Global News is getting several emails every day from people still working at their workplace who really wish they weren't. What do you have to say to them, and are you hearing the same thing?
Yes, we are hearing the same thing. It's important to respect two rules. First, always stay no less than 1 to 2 meters from other people and wash your hands. But we have to understand, and I know, and that's why I'm thanking all people that have to work in the healthcare network, in our groceries. People, they will still need to eat in the next weeks and months. So I need the people. And I can understand that some of them may be scared about the situation, but we need them. Be careful, but we need you.
Cathy Sonnet, CBC.
Premier Legault, and perhaps Mr. Arruda, you can complete the answer. Premier Legault, you're basically asking Quebecers to stop any regional travels. Why did you have to go as far as this today?
Okay. When you look at the figures per region, in percentage of the total population of each of these regions, you see that some regions are more affected, some are less affected. So we want to make sure that we don't get more cases in regions where we have fewer people infected. Right now, it's important to say that there's no possibility short-term to close a region. But we saw in other countries that it was successful to do so if you have many cases in a specific area. So in order to do that, we have to reduce traveling between regions. So that's why we're asking people today, if it's not necessary, not to travel from one region to the other.
Last question from CTV.
No? Okay.
Do you have something to add, or no?
No.
Okay. So from CTV, if small groups of people have been in isolation for more than 2 weeks, is it safe for them to see each other in close proximity?
If they have been together for more than 2 weeks, the 2 weeks actually was related to the fact that they were coming back from traveling, probably, okay? But now we are not in a high level of I would say, high level of transmission in the community, but it's gonna come. So we will have, at least later, to consider anyone around you, and especially where there is circulation, as having traveled. You know, they understand, because it's not going to be anymore the people coming from traveling because there is going to be stopped it. It's going to be persons that are infected here in Quebec that can transmit the disease. So it's why gathering together, if not necessarily, is important. And gathering, especially with people at high risk, is not a great idea, because you could be a best friend of somebody, but the other one is older, has a disease, and you're going to give him the disease without knowing it. And so it's why I know it's terrible, but that's the thing to do, actually. We must keep it for the time that we're going to tell you, because when it's going to be new signs of no circulation, or in spring it's going down and everything, even in spring, if it's going to go down, we will evaluate what is the circulation, but it can come back at the old. So let's do it right now to help us to go to spring, and we will see what is gonna go at spring to best evaluate the situation. So the 14 days together from traveling was there because of people coming back from the school break. Now, it's not today, but I would tell you, and we must trying to always let people understand the things before. Not today, but if there's going to be circulation in Quebec, it's almost impossible to say no, unless there is, I don't know, a miracle. So let's keep those habits, and let's try to change this kind of life into something that can be positive. That's my message. I don't want to distress people. I don't want to make people anxious. Don't be anxious. If you're anxious, call somebody. Try to have an activity that you love. Everybody is different. It could be yoga. It could be music. It could be dancing. It could be dancing in line with FaceTime with somebody else. Just be innovative.
Thanks everyone. Merci tout le monde. On se revoit à 16h.
Merci tout le monde.